Sinai-Grace is recognized on a global stage. Coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. Sinai-Grace was recently featured in a documentary-style video that premiered at the Institute for Healthcare Improvement Forum in Orlando, Florida. This national forum focuses on trends in healthcare quality, and more than 5,000 healthcare executives from around the world saw the video showcasing our work with the MI-STAAR project. MI-STAAR is an initiative to reduce avoidable rehospitalizations and is an improvement effort spearheaded by MPRO, which is Michigan's Quality Improvement Organization, and the Michigan Hospital Association. The footage for the video was shot at Sinai-Grace and includes staff who volunteered to be included in various scenes. Here's a look at the video that tells the world the story of how we reduced avoidable rehospitalization here at Sinai-Grace.
MPRO is an exciting organization. Since 1984, we have been dedicated to our mission of improving quality, safety, and efficiency across the healthcare continuum. As a result of that, we work throughout the healthcare system in Michigan and in other states dedicated to improving quality for patients and communities. In addition to our governmental work, we have embarked on a truly exciting program in collaboration with the Institute for Healthcare Improvement called the STAAR Initiative. We're one of 3 states participating in that major initiative to look for ways to reduce hospital readmission rates across the entire state of Michigan.
The problem with the rehospitalization rates in Michigan, like many states in the country, is that they're high. If we take a look at the Medicare data, we have approximately a 20% readmission rate in Michigan itself. And then breaking down by county, Southeast Michigan has the highest readmission rate for the state. MI-STAAR is Michigan State Action on Avoidable Rehospitalization. And the objective of the program, it is a 4-year statewide program in which we want to reduce all-cause 30-day readmissions by 30% in 4 years. Also, another aspect of the program is that we want to improve patient and caregiver satisfaction with care transitions and care coordination during that time. MPRO's role in the MI-STAAR program is co-leading that project to its success, and we co-lead with the Michigan Health and Hospital Association. And also what we do is we really pull together the healthcare community and also community organizations in order to develop a healthcare community cooperative.
Sinai-Grace Hospital is located in the largest, poorest big city in America. Our population is almost 97% Black, and we are in the top 5 for every major health indicator in terms of adversity in the country.
The MI-STAAR project has meant to Sinai how we transition our patients home and the education we provide while they're in the hospital, and our post-discharge follow-up that we provide to the patient once they're at home.
When patients first arrive to the hospital, most of our patients are seen in the emergency room. At that point, they are seen by a social worker and a case manager, where they start the assessment with the family present in the emergency room. When you have the family present at the beginning of the stay, it's so much easier to plan where they will be going post-discharge.
The Teach Back Here at Sinai-Grace is a method of teaching that the nurses provide to the patients, and it's a non-shaming way. So we don't want the patient to feel that they don't understand. So we want them to not just say yes or I understand. We want them to reiterate what they have learned. So the nurses will teach the patients about their medication, their signs and symptoms of heart failure, follow-up appointments, and identify who their primary care provider is. And when they're all done, the nurse will ask the patient, okay, to make sure that you have a clear understanding of what I've taught you, can you please teach me back in your own words what you have understood me to tell you?
Peggy helped me with my glucose monitor, and I have to read back everything to her, everything that she taught me, and I believe I did pretty good.
We are contacting our patients on a regular basis post-discharge, something we didn't do before unless we were questioning about how was their stay. Now we're actually finding how are they doing.
My support after I left Sinai-Grace Hospital was great. Peggy called me and talked to me and continued to call and talk to me and continued to see me on a regular basis. And I really think I needed that at that time because I don't think, honestly, I don't think I would have made it.
Financially, a hugely reduced readmission rate obviously would affect our bottom line very positively. If Mrs. Jones stops coming back to the hospital to get care that she can get on an outpatient basis, it's going to allow us to manage our costs and our resources much, much more effectively. It will also be an indication that Mrs. Jones is better. And that's going to be something that will, for all of our sakes, be an indication that the preventative health measures, or at least the post-hospital measures that we're hoping that Mrs. Jones engages in, she's taking seriously and following through.
The future of MPRO is truly promising. As our nation undergoes a major transformation of healthcare, MPRO is well positioned to help lead the improvement of quality of care for our residents.
As always, you can catch every episode of Sinai-Grace Today on our YouTube channel and Facebook pages. I'm Melanie Moss. Thanks for watching.